Hi, I'm Danielle,
And I'm Maxine.
and we're the founders of Otto Health. We're going to be putting out a bunch of content over the next few weeks to help clinicians that want to launch their own practices. We have this full service solution that really holds clinicians' hands through the launch process, but we know that some clinicians want a much lighter touch support and are really interested in doing it all themselves. And so we hope that our content gives them the information they need to do that more easily. The first thing that we're going to be talking about is compounding pharmacies. This is a key question for a lot of cash pay clinicians that expect to work with compounding pharmacy partners to provide medications to their patients. But there is a lot to learn in the compounding pharmacy landscape, and it can be quite confusing. So we have a new article that summarizes some of the key considerations. We know that some people learn better by video and audio over text, so these videos will hopefully provide information for everyone.
And so if you are a practice that's using compounding pharmacies for weight loss, for hormone replacement, for any sort of functional medicine, this might be a really valuable video for you as you're selecting the compounding pharmacy or pharmacies that you want to work with.
And so we'll go through a few of the key considerations, and we'll also summarize some of the questions that we think are worth asking any pharmacy that you're considering using. So to start, one of the things that might seem quite obvious but is pretty unique to the compounding pharmacy world versus the retail pharmacy world is the question of inventory. So in the compounding pharmacy world, each pharmacy has their own formulary, which means that they offer very different products. So it's not that you can really say, okay, compounding pharmacy A has ABC, compounding pharmacy B will have the same three things. They have their own unique combination of medications and different alternatives. So it's really with understanding what is their catalog and does it have all the things that you need. So one of the first things that we recommend doing is writing out, these are all of the medications that I expect to prescribe very frequently, and then checking against those compounding pharmacy catalogs if they have all of those medications.
One thing that I'll add to that is it's common that some compounding pharmacies will only work for some of the medications that you prescribe, and it's really normal to work with more than one partner as is necessary, but especially when you're first getting started, there might be value in streamlining it and just having one main person who can service all of your medication needs. Another thing to consider here is about quality. So quality is a big topic in the compounding pharmacy world because they are slightly differently regulated than the drugs that you might get at Walgreens or CVS. And so there are two types of licenses that are really meaningful in the compounding pharmacy space, 503A and 503B facilities. 503A facilities are only able to create medications for individual prescriptions, whereas 503B facilities can create larger batches of prescriptions, and this means that they need more regulation. So just because something is only a 503A facility doesn't mean it's necessarily worse quality, it just is held to different standards. In the case that you're working with a facility that's only a 503A and not a 503B, one way to ensure quality is to make sure that that 503A is regulated by multiple states. So that means that you can send prescriptions to a wider number of states. This means that there are more people giving oversight to the pharmacy quality. Other things to think about are the kinds of tests that are being run by the compounding pharmacy on the medications. The test that you will want to ask for is about stability, sterility, and potency. And there is documentation that you should be able to get on the results of these tests to make sure that the medication is good.
And the only thing I'll add there is it should be the case that every batch is independently tested. So the question of batch testing is a really important one.
Totally. And the thing to ask for if you ever want to see that documentation is a certificate of analysis. And any compounding pharmacy that you work with should be able to provide you that for every single batch. Another thing to consider here in the quality bucket is the beyond use date. And this is basically like the use by date that you see on a carton of milk or something like that. Beyond use dates really depend on the pharmacy, on the process, and on the medication. So when you're buying or ordering a medication, the beyond use date might be different depending on the batch that you're ordering from. You want to be really aware of this because it will limit the amount of time a patient will be able to use the medication that they're on.
And this is especially important probably if you're ordering medications to your office, because it means that you'll be able to make use of the entire medication rather than having it go to waste because it just was expired.
A few more things in the quality bucket. So ingredient procurement is something that we learned about early on in our exploration of compounding pharmacies. And for some patients, this is really going to matter. There are different places that you can get ingredients from, and there are also different ways to make the medications. So depending on, let's say, either ingredient preferences, sometimes intolerances. You want to be really careful about where the ingredients are coming from, any sort of other contaminations or in sourcing. The last thing here is to make sure when you are vetting a compounding pharmacy to check if there's any sort of warning letters or violations in the past from the compounding pharmacy. This might be something that happened long ago and it's no longer an issue, but if it's something that's more recent, it might be worth asking your rep about.
And then the other thing to keep in mind here as well is even Reddit could be an awesome resource. So just searching the compounding pharmacy's name and then Reddit, you might find some threads of patients that have used medications in the past or have worked with customer service, and you can get a lot of answers there too.
Totally.
The next piece that's pretty important is the cost question, and this actually becomes more similar to the retail pharmacy landscape in the sense that there are massive variations in cost. The prices really do vary very significantly. So for example, we looked at 12 popular compounding pharmacies and how they price semaglutide, and the price varies from $9 per milligram to $70 per milligram, so really significant price variations. As you're exploring prices, which should be on those catalogs that you ask for, you should also ask about discounts that are offered. A lot of compounding pharmacies will offer volume discounts, and sometimes they'll even have new clinic discounts where they assume that you have a certain volume even though you might not just yet. So definitely worth asking about the discount piece. And then the last thing to keep in mind is the ancillary costs. So things like shipping costs and material costs could vary pretty significantly too. So it's important to know what is the all-in cost of this medication, including both shipping and any other materials that the patient might need.
A couple of things that I'll add to that. First, I think something that's surprising, and this is even true in the retail pharmacy world, is that cost is not necessarily equal quality here. So it's really not that, oh, I'm going to pay more for a medication and get a higher quality thing. It could just be the operational differences between pharmacies or what the different pharmacies think that they can get for a certain medication. So really you need to do your research on quality and cost separately. The other thing to consider is with those ancillary costs for supplies and things like that, there's a lot of places that patients will be able to get supplies from. So if the compounding pharmacy for some reason has more expensive supplies, you could also send your patient to somewhere like Amazon or another online marketplace where they could get the supplies that they need to deliver their medication at home.
Absolutely. And then the next piece that's worth considering is the patient experience more broadly. We know that as a cash pay clinic owner, this is probably a critical question for you, and this is something that really will make or break your business operations. There are a few things that we like to emphasize in particular. The first is the shipping speed. Obviously, in today's world, people expect things to come very, very quickly, and it's worth asking the compounding pharmacy how long it takes them to turn around a medication, which includes both how long it takes them to produce it and also what their typical shipping speeds are, and this might vary pretty meaningfully. If your patients are located in a similar area, so for example, if they're all in Florida, there might be value in having a compounding pharmacy partner that's based in Florida because you can have quicker shipping times as well. The next question is customer support, and this is again something that varies a lot between compounding pharmacies. Some of them have amazing customer service and some of them have not so good customer service, and this is something that's pretty hard to diligence as you're just starting to have these conversations, and this is where Reddit again can be a really awesome resource, and even placing an order yourself can give you a sense for what that customer experience looks like. And then the last question is shipping requirements. Some compounding pharmacies will require a signature upon delivery, which can be pretty inconvenient for patients. So worth keeping in mind what requirements they might have aside from just the shipping speed.
Just a small handful of things that I'll add to that. You might have to just warn your patients that shipping speeds are going to be slower than they might otherwise expect on things that they order online. And that's something that you and the patient will want to work together on so that your refill cadence is commensurate with the time it might take for the medication to arrive. So there is a bit of a necessary adjustment that's needed in terms of expectations almost always. If you find a partner where that's not the case, that is more the exception than the rule. On the customer support side, this is really with patient-facing customer support. So if the patient has questions on medication that you don't necessarily want to or don't feel like you can answer, the question is really, can they get in touch with an expert from the place where they got the medication? And then on the shipping requirements front, there are often ways where you can toggle on or off some of those requirements depending on the pharmacy that you're working with. So they might by default have a signature requirement, and you can always ask and see if that's optional or not. The final thing here to consider is on the provider experience. So of course the patient experience is important, but the provider experience, your experience, is important as well, especially if you are a solo practitioner launching your own business. You have a lot on your hands and you want to make sure that you have a support team around you that's really able to help you and help your patients. So a couple of things to consider in this bucket, more than a couple actually. The first is whether you have a compounding pharmacy that can integrate with your EHR or your e-prescribing system. It's not super common that compounding pharmacies will integrate with EHRs or prescribing systems, but there are options for, let's say, API connections or other sorts of things that make it easier to work with the compounding pharmacy, even though they're not in the same system. The other thing to consider is customer support on your side. So let's say you have a question about a new medication, or a patient asks you a question that you'd actually like to have the answer to, but you don't. Instead of setting the patient to go call that pharmacy, you might want to pick up the phone and call a pharmacy. So in that case, the question is how quickly can you get in touch with a pharmacist to ask those kinds of questions? The same thing applies for the more operational side of things. So if you send in an order and then you never get the confirmation, or your patient hasn't gotten an order that you placed and you expected them to get, how quickly can you get in touch with someone who can help you problem solve? The final thing here is thinking about administrative requirements. So there are some pharmacies that are going to require things like wet signatures, being in the same state as your patient, other things like that can make it a little more challenging to prescribe. So you want to figure that out on the front end so that you have the operational setup in place when it actually comes time to start prescribing to patients.
And the only thing that I'll add on the software front, so as Maxine mentioned, it's pretty rare that you'll be prescribing in your EHR. Although some of the compounding pharmacies do have integrations with the EHR in one form or another, they do often say that they recommend you use their standalone system to have the quickest delivery times for your patients. And most providers do choose to do that, even though it might be a bit more cumbersome for them. And so it is worth taking a look at what their prescribing system looks like and just seeing if that's something that you could imagine yourself using. The reality is, most of them are pretty archaic, and you should probably set your expectations in terms of the usability of the software. And there's a decision that you have to make in terms of patient experience versus provider experience. Most providers choose to emphasize the patient experience first, at least in the beginning, but it's not an obvious question to answer. And so it definitely is worth getting a look and feel for what is the software and how difficult is it to use.
Totally. I think that's especially important when you think about for systems that don't integrate. If you're going to be copying information over from your EHR into the standalone system, are you able to do it in a reasonable-ish amount of time, or in a way that you feel like is repeatable enough that you're not worried about any data quality issues? So the balance is more of an art than a science, and that's a really good point.
The last thing that we wanted to do is just run through some questions that we recommend asking all compounding pharmacy partners. And you can even copy paste this list into an email and just send it over and see what you get back. Usually the representative that receives that email is pretty good to respond to the questions and provide the necessary detail. So the first question that we recommend you ask is whether they can provide a complete catalog of all of the available compounded medications, including both provider level and patient level pricing. And here I'll explain that distinction. A lot of times the pharmacies will have a catalog that has discounted prices that are available only to providers. So if the clinic pays for the medication first, even if they pass those costs on to the patient, it's a lot cheaper. Sometimes the patient level prices actually won't be that much higher, and you might want to actually use those patient level prices because then you can cut yourself out of the equation from a financial experience perspective. So all of that to say, worth understanding both the provider level and patient level pricing so that you can decide which of the two paths you'll go down.
The one thing that I'll add to that too is there's a workflow question that kind of underlies this, which is if you do use the clinic level pricing or the provider level pricing, you will pay for the medication to the pharmacy and then somehow have to collect that payment back from the patient. So there's a lot of ways to handle that, and it's worth thinking if the provider level pricing is a lot lower, thinking through what that workflow is going to look like in your clinic before you offer those prices to patients. The next one, and we talked about this a little bit earlier, which is asking the pharmacy whether they offer any discounted pricing for new providers or for volume. The next one is about costs for shipping and supplies, which we also talked about, but you can often see those costs for supplies in the catalog. Rarely are you going to see the pricing for shipping in the catalog.
And then you can also ask about how often they change their inventory. Some pharmacies are constantly adding new products to the mix, and that could be really good for you to know as new things become areas of interest for patients as well. And then worth asking if they're licensed as a 503A or 503B facility. This is something that you probably could find from a pretty quick search on their website as well. But if you want to get these questions out to many compounding pharmacies, definitely feel free to do that. And then similarly, in how many states they are licensed, which again is an indication for how strictly regulated they might be.
On those last two questions, it also might be worth asking, even if you think you have the information from online, because what you might learn is that they are going to get licensed in a new state soon, or they're going to add on a license, a 503A or 503B license in the not so distant future. Compounding pharmacies, especially now, given the interest in some of the medications that they offer, are really upping their game. And so there's quick changes that are happening. So even if you know the answer, there might be more to share there. The next question to ask is if the pharmacy is performing full stability, sterility, and potency testing on each batch, like Danielle mentioned, and if they can provide certificates of analysis on every batch. The next one is what is the beyond use state? And you want to ask that specifically for the medications that you're going to be using. Again, depending on the batch, it might be different, but they should be able to give you a range that you can then kind of operate on.
And then similarly, given that beyond use state might vary by batch, it's worth understanding how can you access that information on an ongoing basis. Some of them have that directly in their e-prescribing system, so just knowing how you can see that would be really helpful.
That is also important from an operational place, because if you can't see it and you need to go ask every time that you're thinking about ordering something, it's going to make it a lot more challenging for you to give yourself and your patients an estimate of how long they need to use something by. Asking for a bit of a more qualitative question about approaches to compliance and quality assurance might just give you peace of mind that you're working with an organization that really cares about these things for their patients and for their providers. The next thing to ask is about where they're sourcing their ingredients from. And this is particularly important for carrier oils like grapeseed oil, cottonseed oil. There's a lot of conversations about seed oils, and especially for folks who are really health oriented. So having a clear sense of where these carrier oils are coming from can be really important.
And then a few patient experience questions. What is the turnaround timeline once an order is placed? What is a typical shipping speed? Whether a signature is required upon delivery, and what options exist for patients who might find this inconvenient, how patients can reach customer support, and what those average response times might look like when a patient tries to reach customer support.
On the technical front, you want to ask questions about which e-prescribing system the pharmacy uses, whether you can see a demo, which would be really helpful for you to get a sense of just how challenging or not challenging it is to use, whether the pharmacy integrates with any EHRs, whether the pharmacy has a public-facing API, and if so, whether you can see that documentation. Even if you're not technical, having that information available, if you are to add on, let's say, more support, might be super valuable in the future. A few more questions on the API. You might want to ask if there's any revenue requirements to gain access to the API. This can actually be something that's quite common, where you're only allowed to integrate if you have a certain amount of volume that you're passing through to that clinic. So worth asking that question. And then also checking if the pharmacy provides any support on integrating with the API.
And then a few more questions on the support front. Will you have a dedicated account representative, and how can you reach them? How can you reach the support team more broadly? By phone, by email? Can you access the pharmacist directly? And if so, how? And how quickly do they respond? And then finally, if there are any additional administrative requirements to be aware of, such as wet signatures or same state restrictions, things along those lines that you anticipate affecting your practice.
That last question is super important because it's also something that might change over time. Make sure that you ask about that and ask about any anticipated or maybe even former requirements that are no longer required.
That's a great point, and maybe something else that we'll do another post and video on as well, which is the regulation related to compounding pharmacies is very quickly changing, whether that be things like, do you have to see the patient prior to prescribing a controlled substance, or which medications can they actually prescribe? Are GLP-1s on that list, yes or no? These are questions that are very quickly changing, so it's important to keep your finger on the pulse on those questions too.
This also really varies by state, and so we need to make sure, especially if you're a multi-licensed provider, that you're thinking about that for the different states that you might be licensed in and for the different patients you might be serving. that seems like a whole other topic. So we will leave it here today. Thank you so much for watching. And if you have any questions, you can reach us at info@ottohealth.io.
Thanks.